After a catastrophic event like the genocide against the Tutsi in 1994, it was pretty much chaos.
This hospital was built as a partnership, and all the story is a story of partnership with the government of Rwanda giving its land for building a hospital for the people of the district, and Partner in Health mobilizing the money to build that hospital, and the people of the district building that hospital under the leadership of people who have the knowledge, architecture, etc.
I think there is a combination of our mission as partners in health, as well as the vision of the government. It goes back to the basic understanding about health as a human right, understanding that it's a moral call for us to really make sure that we respond to those needs in those rural places, making sure that the poorest among the population, first of all, is lifted from poverty, but second also is provided access to all health services that they deserve. From 2000 to 2008, 2010, the Ministry of Health and the government have been investing a lot in rebuilding the system. In that work, we have been a key partner, especially in the Eastern Province, where we supported the construction of 2 hospitals and several health centers, where we supported the capacity building of healthcare providers. So when the pressing need to have an additional district hospital in Burera, we joined hands.
Burera District was among the 2 last districts to get a hospital. When this hospital started, the region has no electricity, water was an issue.
The construction of Butaro Hospital has played a big role boosting the community, and it has accelerated infrastructures like electricity, water, internet connection, schools, roads. Even now we have the University of Global Health and Equity around the hospital.
All these connections that the hospital is making to the economy of the country, of the region, it's amazing. All these people you see around here used to go to do over 5 hours of work to go to seek primary healthcare services like maternity services, like child health in another district. Now they have a nice hospital in the district, a hospital which provides not only primary healthcare services, but also the other advanced services like oncology.
We did a lot of work in terms of providing access to those basic services in Butaro. When we opened the hospital with 150 beds, we had a feeling that this was enough. It will serve the population pretty well. But in the first couple of years, from 2011, 2013, the bed occupancy was around 80%. By 2015, we're already using the space of the hospital by 100%. Today, we are overcapacitated. The bed occupancy is around 120%. So that shows you that the needs was there, the burden was there. Even though we recognize and are really very proud of what we're able to achieve, there were basic services missing in Butaro for the entire 350,000 population, which we need to respond to by expanding the hospital. We selected Butaro Hospital to provide our oncology services, not only for the district, but for the national level.
This is a regional cancer center of excellence. So we receive patients from all the provinces of the country and patients from neighboring countries like DRC and Burundi. Before this center, these patients really had very limited options because only those with the means could afford care in private hospitals in Kigali. So it was really an opportunity for the majority of the vulnerable patients to also get access to good care. Back in 2014, the number of patients was not as big as today, but as we were providing cancer care and as the awareness increased among the community, we have been seeing an increase in the number of patients.
We opened the service in 2012, and in the first year, we enrolled 561 patients. By 2015, we had 4,500. To date, we had enrolled close to 13,000 patients that are coming from all over the country.
So we need more space because some cancer patients can have low immunity. So you need to put them away from other patients so that they don't get their diseases. Another critical need for this hospital is a CT scan and mammography. Over 75% of cancer patients need a CT scan, either to know the extent of the disease or to monitor the treatment. This hospital currently doesn't have a CT scan, and we have to refer our patients to the hospitals in Kigali to do CT scan. That means that you have to wait. Some of our patients get lost in the process. Another critical need in the hospital is the intensive care unit. The fact that this hospital doesn't have an ICU unit, it limits our capacity. For example, there are some chemotherapy regimens that we cannot use here because if a patient gets very sick, then you don't have an intensive care unit, then you can easily lose that patient.
My hope is that instead of sending people far from Burera District Hospital, now we treat patients on site and improve in quality of service.
Nanone no mu kwagura ibitaro bizatuma natwe twigiramo. Turacyakeneye kwiga, wenda hari ibyo tuzi, hari amahugurwa twahawe, ariko ntekereza ko ibitaro nibyaguka natwe tuzaguka mu bitekerezo, tukaguka mu bikorwa, tukaguka mu bushobozi, tukaguka mu kubasha kubona amahirwe yo kongera kwiga ku byo twize. Ntekereza ko ari abarwayi bazungukiramo, ariko natwe abakozi ntekereza ko dufitemo inyungu.
Another element that really pushed us to think about expanding the hospital and upgrading the hospital is also providing the great experience to the students. The University of Global Health Equity have started the medical training. So we want to give them a high standard experience where they will get a sense of the comprehensive care of patients from medical, surgery, psychological, intensive care and so forth. So we really need to make sure that the hospital is ready for that as well.
Are you thinking of addressing?
UJG provide education for quality service delivery in Rwanda, for Rwandan and others. So we are a global institution to educate global young cadre that will be leaders to create health systems across the world with the philosophy of quality care in remote area, focus on access for the vulnerable. Our students will have state-of-the-art education in clinical practice, plus strategic thinking and social determinant knowledge to make sure that the patient they will have the most of the clinical service they will give.
So we have, for me, 3 universities. A university with walls in the form of UGHE. We have a university with patients, which is Butaro Hospital. Then we have a university without walls, which is the community. The 3 of them are very important. We have a hospital that needs to be expanded to take care of that teaching.
We need more people educated to provide quality care for the vulnerable across the world. UJG is there for that. And we have a hospital that is going to be increased now to be the clinical teaching platform of our university for people to be able to provide such quality care across the world.
I see Butaro as a satellite of light where we are teaching the future Rwandan health professionals to take care of many health needs of the Rwandan population. At the same time, this is a beacon of light and a satellite for the East African region. Further than that, it is a satellite for the continent. And I see globally the people out there coming to Rwanda to be involved in the learning and learning new ways of taking care of people's health.